All right. So I'd like to welcome my dear friend and colleague, Dr. Wendy Dryden. So, Wendy, are you with us? Oh, I saw you pop up on the screen. Please unmute yourself and come on in when you are. Because
Yeah, I'm here.
all right. It's about time.
Hey!
You're a little bit late, but
No,
anyway.
I'm not. I'm on time.
All right. All right. I'm just giving you a hard time. In
Yeah,
any
right.
event, so we have a question. The floor is open to ask the good Dr. Dryden questions. But first of all, I want to start with a question, Wendy. We had a question about curiosity, whether you would label that a cognition or a feeling. I'm curious how you would respond to that.
You're curious about whether I think curiosity is a feeling or a thought.
That's
Well,
exactly the question I asked.
I think that probably it's, as Albert said many years ago, we can't separate out, these things entirely. So I would be happy to kind of regard it as a feeling related cognition.
Well, one thing we know is that we're on the same page
Good.
because that's more or less the way I put it. That the 58 article that talks about cognitions being, we talk about them separately, but thoughts, feelings, and emotions are more or less different sides of the same phenomena.
Indeed, we do.
All right. So, who has a question now? We have a rare opportunity to talk all things REBT, all things CBT, and you could even ask us a question or two about another form of cognitive behavior therapy. Who's got a question? Omar.
How you doing, Dr. Dryden, and how you doing,
God,
Doctor?
you've been stalking me, haven't you, Omar?
No,
Omar follows me around wherever I go. He's there. You know what I mean?
I'm everywhere. That's what it is. Yeah, I do a
Okay,
lot
go
of
ahead.
Good to see you. I wanted to ask you actually, what's the latest book you're reading? Because I'm always intrigued. Yeah,
I'm reading
yeah. Well, I'm wondering what's the latest book you're reading at the minute.
Craig David's autobiography.
All right, interesting. So how do you apply that to your single session therapy or REBT sessions? How would you apply it?
I don't. It's for pleasure. Not everything's
All right.
related.
It's all right because I always think if when you're reading books, you're always able to apply something or connect.
Well, I mean, yeah, I mean, I can. I mean, I don't know how interested people are in Craig David, who was quite
Singer.
he's an R&B singer that made his way in the late 1990s, and I think what I take from his book is that the problems of the tyranny of the positive, which I think is really where you kind of really, I think you have to feel positive, make a positive contribution all the time, and in doing that, you quash your healthy responses to adversity as well as your unhealthy responses to adversity. So what I take from that book is beware of the tyranny of the positive.
Beware of them or encourage them.
What the tyranny of the positive? Why would you want to?
You said beware. You said beware. Why would you want to beware of? Oh, the tyranny. I have to be positive rather than.
Listen, I know you've been working for an hour, so your listening skills are a little off there, Wally. No,
but the point being is what? Not to insist on always being happy.
That's right.
That's right. You can make disturbance that way. Okay, good. Zoom user. I see. I don't know what your name is, but ask the question, please.
Would that be me? I'm Jeff Tansey.
That's you. That's you.
I've been a patient of yours, Doctor, and Dr. Dryden, incredible books you've written. And they've impacted my life greatly. I'm sorry, I'm getting rid of the lawnmower here.
Do you have a question or a comment behind the?
Yeah. I'm gonna. The comment is that your incredible deference to Dr. Ellis and his profound things have made my life just so much better. I've been diagnosed with cancer. I've been told I'm eligible for hospice. So I guess that means 6 months to go. And I feel great. And it's because amor fati, embracing your fate and loving it. And in the meantime, I'm going to make my 50th class reunion next May. So I'm going to fight this. But they say there's little hope. And today's lesson was so powerful that I sit. So I'm going to the oncologist's office. They thought they were just going to take a little thing off of my scalp, but they did a PET scan and it found it in everything but my spleen.
Wow.
And it just was like kind of that's a kick. That's a challenge. So you've empowered me to deal with this. And when I die, I'm going to heaven. So everything's going to be good. Or I'll be a dead guy. And that's good. Thanks for letting me talk. Sorry to bother you.
No, you're not bothering us. And thank you very much.
I'll probably be waving to you from the other place, though.
It's gonna be fun, man. No, they tell me I'm going to the Lake of Fire, and that's a probabilistic thing.
Yeah. Okay. Well, we'll see.
Well, stay strong and flexible.
Yeah.
When I die, then we can determine.
Right.
Keep having a good time till you take your last breath. Jorge.
Cowabunga, you guys are brilliant, and I'm telling you, it worked, and it's going to continue to work, and it haunts me when you say you're going to die with a smile and a good sense of humor, and fuck 'em, bring it on, man.
Yeah.
There you go. Yeah. Jorge.
Yeah, Dr. Dryden, thanks for joining us.
My pleasure.
And number one, I took two little questions. One, the name of the book again?
Which book?
The one that you're just reading, the one you were talking about just now.
Oh, Craig David. Oh, something about what's your vibe?
What's your vibe? Thanks.
What's your vibe?
And the other one was, can you tell us a little bit about single session therapy?
Yes, if that's okay with Walter.
Sure.
Okay. So single session therapy is based on the idea that quite a few people don't want to come to therapy for a long stretch. They're quite happy to see what they can get from a single session. And what we need to do as therapists is to adjust our approach so that we don't withhold the therapy for people who want it right from the back. So we get cracking. We dispense with assessing the person. We dispense with taking a case history and things like that, and we get down to business. We want to find out quickly what the person wants to address and what they want to walk away with. And we try our best to help them to walk away with that, utilizing whatever strategies, techniques are appropriate, to what the person is actually bringing.
And do you expand the time frame on that, or is still you expand the time frame where you stick with a typical 1 hour, 45 minutes?
Well, no. The way I do it, it's less than 50 minutes. I say it's up to, because we waste a lot of time in therapy, I think, So by cutting to the chase, I find that I could do a decent enough job in less than 50 minutes.
Yeah. So in a way, REBT could be viewed as a single session therapy process, although obviously not just one session.
Well, my guess is that most of the sessions that Albert had were in fact single sessions, because although he saw people for long periods of time, if you had listened to his tapes, and what he used to do, he used to put his tapes of all his sessions, most of which were first sessions, into I'm talking about the old cassette tapes, into the fellows room. And whenever I used to go there, I used to avidly listen to them, and he would say, okay, so you go work at that, and if you want to come and see me again, make an appointment at the front desk. So he wouldn't really push seeing somebody again. He kind of let it up to them, and I think that's a good way of going about things.
I'd like to add, I was listening to an audio tape this morning of Albert introducing REBT, and he emphasized the self-reliance aspect of an emotionally healthy person. And so that tendency to just push, all right, go home and work on that yourself is really just part of his stance, that we want to encourage people to be self-reliant rather than dependent upon therapists.
Yeah.
All right. Anything further, Wendy, on the single session therapy model?
I could talk for hours in it, but it's not my show, so I won't.
Let me just ask you one last question. My guess is that much of what you do in those single sessions is overlapping with the theory of REBT.
Well, yes, if the client doesn't have anything to bring to the table themselves, but I mean, I'm informed by REBT, of course.
Right. So you haven't abandoned many of the tenets of REBT when you're doing single session therapy.
But you're helping people in other ways. You're helping them to connect with what their strengths are and bring those strengths to the table and
problem.
So I mean, I think that the beauty about single session therapy is not limited to any particular way of working. You can actually draw upon different perspectives.
Great. All right. So
good idea. Thank you.
Yeah. All right. Casey had her hand up early on. Are you still around, Casey? Because I'm trying to take people in order. But if Casey, put your hand up.
Yeah,
there
I'm
you
here.
are.
I just had a quick question. So I don't know how easy it is to find a therapist that provides REBT. So are there other types of therapies that you think are useful if you can't find somebody who does?
Yes. I would argue that DBT, if I didn't align myself with REBT as an REBT therapist, I don't think DBT is quite as strong as REBT. I think it doesn't have as good disputing as REBT does, and but it overlaps sufficiently well so that I would look for a DBT therapist.
Okay.
If not, then a Beckian trained therapist, maybe.
Beckian, you said? Okay.
Yeah, Beckian, as in cognitive therapy, a la Aaron Beck.
Okay.
How about you, Wendy? How would you answer that question?
Well, let me ask Casey a question first, if I may. Right, Casey?
Yes.
How's the Sunshine Band doing?
Say that again. I'm sorry.
How is the Sunshine Band doing?
The Sunshine Band?
Casey and the Sunshine Band.
Oh wow.
Yeah, come on. I would say I would agree with my good friend Walter on that. I think although I would say, you can get good REBT therapists and bad REBT therapists, and I would say avoid anybody who is rigidly practicing. I'd rather you see somebody flexible from a different orientation than see a rigid practitioner from REBT, DBT, or any other sort of letters that we put together.
Okay.
All right, JT, I think you were next. Oh, Casey, were you going to ask a follow-up question quickly?
Yeah, I've thought a lot about like psychoanalysis, but I guess now hearing about REBT, I don't know if it deals enough with the here and now. What do you think of that type of therapy?
Well, I mean, I think there are different approaches to psychoanalytic therapy, but I think that if you are going for psychoanalytic therapy, I would go for certainly the briefer versions of it, because I think you want to avoid the longer term versions of it. And actually, two of the earliest forms of single session therapy, actually, Casey, were conducted by Sigmund Freud himself. So unfortunately, he didn't bring his insights back to his everyday practice. But so again, we want to go focused. I think if you have specific problems, then you need to have focused therapy.
Okay. Thank you.
Yeah, I would prefer that you seek a more action-oriented, solution-focused therapy, more along the cognitive behavioral tradition. But I don't mean to be disrespectful to my psychoanalytical peers, but I really think that you stand a good chance from a probabilistic standpoint of being disappointed with the time and money you spend. But that's just my view. I could be wrong. JT, I think you were next.
Hi, thank you. One of my questions as I'm learning is, I believe the REBT says, accept the things you cannot change. And how does one define that? In my own personal life, I've been told to accept the things I cannot change and did not, and then actually did change someone's life or certain things in the larger world. So like you always say, like the world is flat, but it's not. So how do you all define that? Like, how do you define what can't be changed when we change things often?
You don't know in advance. So I say try to change what you can, but while it exists and it's not changing, accept its existence until either you pull off the change or you decide that after a good go of it that it's not worthy of further effort. But you don't know in advance what's changeable. We live in a probabilistic world, and so no one knows for sure. If somebody would have told me 200 weeks ago that I'd still be doing this with 200 people or more, I wouldn't have known that were the case. So who knows? Wendy, what do you say?
Well, I think it's useful to kind of ask yourself or other people the question, what is in my control and what is not in my control? Because quite often people want to change other people. You can't change other people, but you can influence them. And what you do to influence them is in your control, and that might lead the other person to change, or it may not. So I think it's useful to kind of, rather than if you're thinking about acceptance, and again, we have to define what we mean by acceptance. It means that, in my book, that that reality is reality, that which is. It doesn't mean that we have to like it, and all the conditions are in place for reality to be reality. But if we change those conditions, we may bring about some change in the reality. So I think we need to kind of be, it's easy to say accept, but what do people mean by the word accept?
Thank you.
I often think of acceptance as an acknowledgement of a negative state of affairs with a willingness to experience healthy negative emotions in the face of that negative state of affairs, while we attempt to do what we can to bring about a change in the negative state of affairs. Yeah. So, iPad Josh.
Hello.
James.
Can you hear me?
Oh, go ahead, Josh, or whoever's. Yeah.
Hello. Yeah, it's me. Hello, doctor. Both doctors. Dr. Walter, you said something, I believe, 2 weeks ago, which struck with sticked with me. You mentioned that you believe REBT is more effective, or I don't want to say the word better, but you were saying that it's more effective at certain tasks than Stoic philosophy. And you didn't expand on that further. And I believe with Wendy here and you, it could be a good topic to bring up.
Yeah. I mean,
expand on that.
So what I'm saying is I think that at least for the modern individual, REBT is more accessible. It's a system of ideas that are interlocking. It is a philosophy, if you ask me, but it's a system of ideas that are easily communicated, that are there's a synergy between them, if you will, and that we can quickly teach people some of the fundamental core ideas. I think in Stoicism, as I understand Stoicism, not that it doesn't prescribe things. Like, for example, a good friend of mine, Greg Lopez, who's a real expert on philosophy, wrote a book on Stoic practices that you could do every day. Yeah, I have it, but I think that Stoicism, in my view, it takes it's harder to translate its implementation. Like, for example, I don't know, let's take, for example, a panic attack. I mean, what would a Stoic say about a panic attack? There are things that, this is something that I'm going to be indifferent to. I think REBT was created in this to address problems, and maybe it's because I'm more familiar with REBT. Despite my familiarity with Stoicism, I wouldn't consider myself "quote unquote" an expert on it. But it just seems to me that it is more easily applied and easily learned to be applied to a wide variety of problems, whereas Stoicism has a lot of, I mean, how many self-help? There are self-help books, I guess, being written now, but that's my view. I don't know if I'm answering it as well as to your satisfaction, but I see REBT as easily learned. You know, there are certain core concepts that can be immediately communicated to people, and people can begin to put them into practice pretty quickly. I'm not so sure if Stoicism can be communicated as efficiently and then implemented as efficiently. Wendy, do you have any comments on this?
Well, I need to say that, it is interesting to note that Stoicism is very popular. So I think one might even say Stoicism is more popular than REBT. And so I think we may have something to learn from those people who are advancing, Stoicism. But I think that, I mean, while REBT is influenced very much by the view of the position of Epictetus, who kind of basically said that people are disturbed not by things but by their views of things. I think we're much more precise about what we mean by views in that statement. But then REBT is influenced by other aspects of philosophy as well, that you kind of mentioned before, Walter, Buddhist philosophy, existential humanism. So I think there are many roots into REBT, whereas I think Stoicism is they've got some good ideas, but and let's recognize that it is very popular.
I think when you say the word Stoicism, it's very sexy. Where REBT is like this, it's not as sexy. But in any event, the thing I'd like to add is I've been just for some reason been using the phrase system of ideas. To me, I see REBT as this interlocking system that's very dynamic. And I have to, and I'm just intrigued by describing it that way. So the next, James.
Yes, thanks, Walter. Good to be here with you both, gentlemen. So my question pertains to writing. And of course, Wendy, you're known as a prolific writer. I myself completed my PhD a couple of years ago. Now I'm facing the task of transforming that thesis into the first book. But I must confess, I'm experiencing some resistance, internal resistance, in a form of procrastination. What can I say? But I'm conscious that I'm capable of doing the task. I mean, hell, I wrote the PhD thesis, right? But I'm wondering, any tips that you yourself utilize when writing, any strategies? And I'm also curious if you've encountered such internal resistance in your own writing practice.
Well, what I would tell you, and Wendy, who's probably more expert at writing than I am, for sure, I would say, James, you could volunteer and we could go into this into great depth. But beyond that, I would say to you, allow yourself to do it poorly. Allow yourself to do it poorly. Much of resistance to writing is either the resistance to how hard it is to do, and what we do is make it harder by insisting that we do it well. Whereas I allow myself to now write poorly. And if I write poorly, anything you do and you do often enough, you'll do better. So all good writing is rewriting, it's been said. And I'd suggest you allow yourself to write poorly. What say you, Wendy?
Well, I mean, the only time I really struggled to write was after my father died. And so I kind of recognized that I wasn't going to fight it. So if you look at the years associated with my books, you'll see 1 year I haven't written anything. And that is because I just went with the flow, along with the flow. I just thought, well, I need to kind of give myself a break. I need to kind of grieve the death of my father. I wasn't really in the mood for writing, and therefore I didn't. But then after about a year or so, I picked up, and I mean, probably the most productive years of my life writing were during COVID. So I mean, I think that the question I always say with procrastination is if we were to give you certain conditions were present that would lead you to write, what would it be? And the opposite of that is what you're struggling with. So if you, for example, think that you'll be creative, and then you'll write, and then therefore you're demanding that you have to be creative before you write. So we often in procrastination, we kind of erect certain preconditions that we believe have to exist, and then we don't comfort, confidence, competence. You might think, well, who's going to be interested in what I have to say, and therefore, you may be waiting around for somebody kind of to say yes, of course, and then you'll get down to writing. So I would say, ask yourself the question, what conditions would have to exist for me to write? And the opposite of that is what you're struggling. And then what you've got to do is to kind of recognize that those conditions are desirable, but not necessary. And you can write without them.
Right. So, for example, people say things like, I have to feel motivated to do X.
Yeah.
And I always tell people, no, it's easier to do X when you're motivated, but you can do X even if you're not motivated. And sometimes action or energy breeds action and energy. So get off your butt and do what you think will kill you. And you'll find that you'll get momentum at doing it. So I think you have plenty of chew on, James. So maybe you could go this afternoon and do some writing and do it in Wendy's honor, inspired by the prolific writer he is. TJ. TJ.
Hi, thank you. So I guess my question is, I know REBT talks a lot about dealing with the worst case scenario of things, and I just try to think of like what's the worst case scenario someone could face. So my question is, what would REBT say to someone, say, facing something like homelessness or a lengthy prison sentence, or one of these like truly worst case scenarios? And where there seems to be little upside to that, what would REBT say to someone who is facing that sort of situation?
Well, I could speak to, I've worked with somebody who was facing going to prison. And the fact of the matter is that what people survive in prison all the time. It's not a good place to be by no means, but it doesn't mean that it's an impossible place to bear. So you just look at the number of people that are incarcerated to get the data that you can survive the existence in prison. Whether you do or not is much has something to do with your choices. And what the worst case scenario is individual. So, I mean, some being homeless would be bad, But if I were homeless, I would certainly try to make it as comfortable as I could. So I always wonder, for example, why people who are homeless, if I were homeless, the first thing I try to do is hitch a ride to a warm environment. So, I mean, but that, of course, don't mean to downplay people who are homeless probably have trouble problem solving and might not think well enough to think of how to get to a warm environment. But so I don't know what the worst case scenario is. Individual, whatever people consider to be the worst case scenario. For me, that would be dying in pain, but I've kind of even worked that out so that I don't want to die in pain, and hopefully I'll get good palliative care should I be dying in pain. But the bottom line is that the pain will end. So I would probably cope with the pain of dying in pain by telling myself, well, it'll be over soon. So just hang in there until the lights go out, pal. So, Wendy, do you have anything to add?
Yeah, it reminds me of a question that Albert was asked once when he was giving a workshop, and somebody put their hand up and said, Dr. Ellis, I can think of the worst case scenario. And they said, okay, what is it? So it's being run over by a steamroller. So Albert said, no, that's not the worst case scenario. And so the person said, why? And so Albert said, because you could be run over by a steamroller more slowly. All right. So as Smokey Robinson's mother used to say to Smokey, there's from the day you are born till you ride on the hearse, there's nothing so bad that it couldn't be worse. See, so anything we think of can be worse. But I mean, we have to think about that as a way of thinking, but we also have to kind of think about how useful that is to the person. Because if you use that technique, you could be seen as being insensitive. All right. So yeah, we can always think of things as worse. There was a guy who kind of would say, all right, so how bad would this be? And the person would say 100. And they say, well, how bad would it be and losing the top of your finger? And they said, well, it'll be worse. And I said, well, no, you can't be worse. You're already at 100. And so he would push whatever it is down and using that technique. But again, it's something that you got to be very careful about when you use it therapeutically. I saw a cartoon once where a guy and his dog was watching the television, and suddenly the announcement came on, and it says, the world's going to end in 10 minutes. Going to be blown up by a meteor. And the guy turned to the dog and says, well, that's pretty bad, Fido, but don't forget there are other planets. All right. So, I mean, what can I say? The main thing, if you're going to use it therapeutically, is you be very careful about using that, and because you can come across as insensitive.
There's something to be pointed out. Wendy has a great article on taking the horror out of tragedy. So, for example, tragedies happen, and we need to acknowledge them. But what we're doing with the concept of awfulizing is removing the awful out of the tragic or the very bad. Would you agree with how I put it there, Wendy?
Yeah, I think so. Yep, I would do. Yeah, taking the horror out of the tragedy, not the tragedy out of the tragedy.
Right. So tragedies exist. That's why I don't like when people say catastrophizing, because catastrophes exist. The question is whether or not the catastrophe we're talking about could be withstood, and whether or not there's good that can come from it, and whether or not there's the day after. So I much prefer terrible or awful, or the end of the world. Hassan?
Hi, yes, Sam. My question is about OCD. So I've trained to treat OCD with various forms of therapy that are, research driven. I'm just wondering how REBT approaches OCD, because I've never heard that particular problem being talked about in one of your demonstrations or ever being talked about by Albert Ellis, because it's a very different kind of beast, OCD. Certain numbers can affect people's life to an extent that's really troubling. So yeah, I'd really love to know what REBT's take is and whether there's a particular way OCD is approached.
Well, the existing therapies like exposure with response prevention are very consistent with REBT. Although on the demonstrations, I emphasized the cognitive interventions. If somebody were to present a hardcore OCD case, it might be better to do what we would call an REBT behavioral disputing, where you have the person expose themselves to the feared contamination and have them tolerate these high subjective units of discomfort until they slowly come off of that top level of subjective distress. So you see, Edna Foa, who pioneered some of these empirically based treatments, actually had some contact with Albert Ellis. And so Ellis would argue desensitize to exposure. Do what you think will kill you and find out that, guess what? Touching a toilet seat won't kill you. It'll be uncomfortable, but not unbearable. But the emphasis would be on the behavioral parts of it. Wendy?
Well, I think there was an article actually by Ellis. So I think if you go on the Albert Ellis Institute website and look at Ellis's biography, and scroll down there, you will find that there will be an article by Albert Ellis on OCD. My take on OCD is cognitively, it is a demand for some kind of purity, whatever the person is trying to have as a condition or to get rid of. And I think so that helping people to kind of develop a flexible set of ideas through whatever it is that they believe that they either have to get rid of or have to get. And then the other aspect of it is what we call the attitude of bearability, helping people to bear what they think they can't bear. But this, I think, for me, like with other things, the cognitive interventions give shape to the behavioral intervention. So they inform the reason why the person is doing the behavioral sort of interventions. So I think that I think REBT's ideas are really highly consistent with OCD. I did a case book many years ago with a REBT therapist called Joseph Yancura, and I think there's a case in one of the sort of 2-volume case book. You'll find something about OCD. But yeah, I mean, I do work with people who have OCD, and I think one of the things that is really important to kind of do is to have them to really see in terms of their experience, what is OCD, because quite often it's a bit like, it was kind of like theory A and theory B. If you think that something is real, that's going to lead to some type of behavior. If you think that this is your problem, then that will lead you to some other kind of behavior, which will be helpful to you. And helping people to be mindful. The thing to do as well is to recognize a lot of OCD is really, I have to be comfortable in the moment, and I think that really repays a lot of sort of therapeutic intention. And then they come up with self-deception, and well, okay, next time it'll be different. Well, you know, it won't be different next time. So,
yeah, and we have to also, what you're really talking about is what I think Steve Hayes would be calling experiential avoidance, whereby they're avoiding the experience of being terribly uncomfortable.
Yeah, and also given that such people are driven by kind of rigidity, they can easily become rigid about the therapy itself. All right, so that's something to be kind of, you probably experienced that, you know, Hassan as well. They kind of be, but how do you know for sure that REBT works with OCD? You know, that kind of thing. It's that's your problem. That's not, you know, I'm not engaging with that. And you've got to be very careful that because they hook you into it, and they, you know, so you have to kind of unhook yourself. And, you know, the very sneaky ways of seeking reassurance sometimes when you work with people who are OCD.
Yeah. Do what you think will kill you. When I read that line in a self-help book Albert wrote, I just loved it, and I repeated it all the time. Do what you think will kill you. Now, that within reason, everyone, for the American lawyers listening, I'm not talking about attempts to fly without jetpack. I'm not talking about jumping out windows, right? But ask that girl out for a date, touch the pole in the subway that is dirty, lift the toilet with your hand. Do what you think will kill you. Lisa.
Hi there. I just have two single session, simple questions. First of all, I love the picture in your background of that famous pipe. I got to say that in your background. This question is for Wendy. I'm curious about the 50-minute session. What do you do when the client comes in and the answer for you is really simple within, the first 5 minutes? And what do you do with the rest of your time? Or what do you say? What do you do?
You mean
with the rest of your time? Like, because you're a 50-minute session.
Well, no, I'm saying up to. And so if we're, if we're finished in 5 minutes, we're finished in 5 minutes.
Okay, so
I say, thank you very much. They say, well, I'm done. Well, I say, well, thank you very much. Okay. But if you commit to a time, they'll say, yeah, but what about the 45 minutes that I've got to, and so I think it's really sort of ending based rather than clock based in single session therapy.
Okay, and I was wondering if you could share what would be one of the in less than 50 minutes single session, what would be one of your most challenging in less than 50 seconds or 50 minutes cases?
Sorry, I'm not.
If you're doing having a client in less than 50 minutes, what would be one of your most challenging sessions? Would that be challenging to you?
What would be challenging to me?
A challenging case. Could you share a challenge?
Which are the most difficult problems to treat within a single session framework?
No, that's problems is not the issue. It's what people want. And so because you're asking what would you like to achieve, and if they say I want to eliminate my anxiety, then right from the back I say, well, I can't do that, but what I can do is, because who can it, in fact that's part of their problem. So I think the most challenging situations is when people come to a single session therapy and they don't know why they've come. They don't know why they're there because they've been referred, and therefore you have to kind of really explain what it is and then really get them on side. But once people have an idea, oh yeah, okay, that's fine, and they have a goal, and I think one of my sort of mantras is really work in terms of what is doable within the goal. And I think if you if you lay the foundations right, then a lot of what seems to be challenging, really isn't. I think it's about really helping people to develop realistic expectations about what they can get from it. Some people think they can't get anything from it. Some people want a lot from it, more than you can possibly give them. Somebody comes in and says, I want to get rid of my trauma at the end of today. I say, well, I can't help you to do that. What I can help you to do is this. So, I mean, I think if you can get the foundations right, then you're and you don't go in with any preconceived ideas, and you're working with what the client's strengths are, and you remind them what their goals are, then a lot of the obstacles, a lot of the challenges melt away.
Okay, thank you.
Yeah. Yeah. I mean, and also a lot of that is also done in regular sessions where people define the problem, and then they define the problem. It gets redefined in a way that you can deal with it. And then you sort out the type of healthy goals that can be achieved with it. Some people will ask for solutions that can't be achieved through therapy, know? So Sarah.
Hi, thank you. Are there any particular resources you would recommend people use to find an REBT practitioner?
Well, if you go to the Albert Ellis Institute, there is a list there of therapists around the world who have been through the training program there. I'm available. So Wendy's available. And then, but that list on the Albert Ellis Institute, look, the thing I would caution you about is if you go into psychology today, for some reason, the fine state of Texas in the United States has many people. I've never seen a state with as many people who list REBT as something they do. And I think that having had a course on REBT and then being identified REBT practitioner. And so I would just encourage, I think that's true about any therapy. There's people that have had some exposure to DBT or ACT or Beck's cognitive therapy and then say, yeah, I do that. But I mean, what you want to try to ferret out if you can is somebody who is trained in it, does it well, believes in it, and then will refer you out when they might think that it's not suitable for you. So people sometimes try to be all things to all people, and I try not to be that. I do REBT. I don't put myself out there as a DBT therapist, but yet on the other hand, there are some overlapping aspects. Wendy, what say you? Do you have anything to say about that?
Yeah, I mean, I think that I'd also be kind of almost as concerned about who the person is rather than what they practice. I think if you can get some really hard-assed, unempathetic REBT therapists, or you can get some very kind, and they're not going to let you get away with it, but I think you've got to think about the interpersonal relationship between you and your therapist as well. It's not just any old REBT therapist will do, but an REBT therapist that you can have a sense that you can open up to and relate to, and be able to kind of speak your mind with. Where about in the world are you, Sarah?
I'm in Florida, and I guess I failed to say a part of what's important to me. I think there's nothing like being in the same room as when you're working with a clinician. And so if you wanted to have face-to-face therapy nearby with an REBT person, would it be just that Ellis Institute list and then query down to your location, or are there any other?
Well, to be fair-minded, there is the International Association of REBT, which may have their own list. And so although there was a split in the REBT world a number of years ago, I think to be fair-minded, I would say, there may be that area as well that is worth.
There's somebody I know in Florida, and I can't think of his name. Wendy, who is that fellow? there is somebody in Florida, but Florida's a big state. So when Lynn or Sarah, when I think of this person's name, if you write to me, I'll send you his name, and maybe he might know someone. Wendy, do you know who I'm referring to?
No.
There is somebody who's well trained in REBT in the state of Florida, and he's been referenced by Al. I can't think of the guy's name right now. Write to me,
Thank
and
you.
I'll bounce that back to you. Lynn, Lyn.
Hi, good morning. I've heard a lot about anxiety and panic, and I'm wondering in REBT, is there a first aid when you're having an extreme A, you're extremely, there's a situation that is kind of blowing you back. What is the self-talk, the thing you can tell yourself in that moment to kind of get through the next 10 minutes?
I'm not sure I understand the question when you say blowing you back. Obviously, if you're not in a safe environment, please everybody mute themselves. If you're not in a safe environment, you better, the first thing I would say is get safe.
Okay. I think I've been in this situation where it's kind of like extreme A, and I'm just
What
looking
would
for like,
constitute an extreme A is what I'm asking.
okay, someone tried to run me over in their, and I hear what you say about getting safe, but I'm looking for like a, what can I say? I can later maybe analyze it, but what can I say to myself in that moment that would be like,
You mean the moment after you realized that they weren't successful in running you over?
Yes.
Thank heavens I dodged the bullet. I just
Okay.
used one of my 9 lives. I mean, after the fact, it's like take a deep breath and like, you know, what did Mark Twain say? Curse or something like that loudly? That might, no, I would say, wow, that, you know, at first you're going to have probably adrenaline that you're going to need to burn off. So you're going to need to accept that your sympathetic activation occurred. And it's like, wow, thank heavens I survived that and let this adrenaline run its course. Wendy?
Well, are you referring to the situation whereby afterwards you have an image of that happening again, or are you just referring to the fact about, you know, what do you say to yourself directly after it has just happened?
Directly after.
Well, what's your, yeah, I don't know. I mean, allow yourself to be scared.
Okay.
You know, I would have thought, you know, like, because otherwise you know, we're trying to be like super rational, you know, like, you know, even when somebody's trying to run me over, I was rational about it, you know. So, yeah, I think that the important thing is, I think there's a difference between momentary irrationality and sustained irrationality. And if you allow yourself, like I think I would, you know, to be scared and angry or things like that, and then after a while you'd calm down and you'd actually get back to a more healthy, rational state. But you know, are you really trying to be rational about things like that? Lots of luck, I would have thought.
Well, thank you.
Paolo? Paolo?
I have some question for you. I'd like to know what is your opinion about mindfulness, and do you think that mindfulness is nowadays overhyped? And do you think is it possible to integrate mindfulness with REBT? Thank you.
Yeah, I mean, I think mindfulness is a very popular therapeutic endeavor that people are implementing, and I don't think it's either or. It can be and both, whereby you practice mindful techniques, but that you don't forget that you can't do that, all the time, and that you still need to have healthy attitudes towards adversity. So I don't think it's either or. It's and both. Wendy, what do you have to say?
Well, I've said that it's a bit like going to the gym. Once you kind of challenge your irrational beliefs, there'll come a time when it's a good idea just to stop and at that point allow yourself to mindfully accept any unhealthy negative thoughts or unhealthy feelings that you get that are still around. Because I mean, I don't think Albert did us any favors when he would say, dispute those beliefs until you eradicate them, you get rid of them, because I think that could cause problems for some people. Now, I don't think he meant that for that to happen. I think he was trying to be forceful, but I think there comes a time when if you continue to challenge an irrational belief, you can get what Stephen Hayes's lot would call cognitively fused. And that's not a good idea. It's a bit like, the reason I say going to the gym is you don't go to the gym expecting to be fit at the end of one visit. It's building up. And so I think that if you can dispute your irrational beliefs for a time and then still afterwards mindfully accept the fact that you have still these thoughts in mind and these feelings, and that you can deal with them later. And so I think I make a distinction between mindfulness in that respect and mindfulness meditation, which is, I mean, if meditation is your thing, then there are a variety of different ways of meditating, including mindfulness. But I think that one of the things that concerns me is that mindfulness is not designed to help people to change their rigid views necessarily. It may help you to distance yourself from it, but it's not going to help you to change your views, your attitudes.
It's kind of like when people say the therapy, you need to show unconditional positive regard. It's like, yeah, that's a necessary but not sufficient treatment. I think that mindfulness is useful, but that you can go beyond that, and it's not either or. So yeah, you want to unconditionally accept, you want to allow yourself to learn how to bring your attention back to your breath and be in the moment and all that. But at some point you also need to go beyond that, I think, and examine some of the attitudes that will trip you up in life. Well, one of the attitudes that I have is that it's most unfortunate that we're going to have to conclude today's discussion, but I'd like to thank Wendy for joining me. Wendy, it's always nice to see your bald head and hear your thoughts. And I would like to thank everyone else who joined us today, and hopefully we'll be at this 200 weeks from now again. So that's my next goal. Please invite your friends to join us, because I need a willing volunteer every week. So Wendy, do you have any final comments?
Time flies when you're having fun.
All right. Well, there you have it. Over and out from New York City.